Hi, this is Dr.Lahari from Dental, Bangalore. When you smile, when you see spaces in among your teeth, it looks like you have missing teeth, like you lost some teeth. When you are a kid and when you are very young, this spacing in between the teeth will look very, very cute. And it is very fond thing also that you have spaces and you will lisp. But at the same time, when you grow up and when you turn into an young adult, the spacings in the teeth, gaps in the teeth actually look like you have lost some teeth and you are missing some teeth, and they look very ghastly when you smile and talk. Despite being the aesthetic aspect, there are some functional deficits also when you have a spacing in your front teeth. When you are talking to the other person, the saliva from your mouth tend to come out a lot when you have spacing in the teeth. It is a very, very uncomfortable situation in the social settings when you're actually conversating with a person and your saliva dribbles out of your mouth. It is the most uncomfortable thing that can happen. And the second thing is that due to the spacings in the front of your mouth, some words like EF, AS, W, which is very difficult to pronounce them, and you tend to develop a stutter or a lisp, which is very difficult to correct in the later time of your life. It will actually lead to functional discrepancy also. Many people with spacings tend to complain, I don't have spacings when I was young, but now I tend to open up the spaces. This chiefly happens with the Women in their 30s, they tend to open up spaces very easily. When they look back at their wedding pictures or the college pictures, their teeth would be very intact, but they are in 30-35, spaces start appearing. For some people, spaces are evident right from the childhood. If the spaces are right from the childhood, that is due to skeletal dental discrepancy that can be corrected through orthodontic or clips treatment. But when the spaces start appearing after a certain age, like after 30 or 35, you should also consider a periodontal component or the gum component. When your gums are weak, when your body calcium level lowers, and we are entering a premenopausal phase also, in some women, a very, very thin bone keeps our teeth intact in the mouth. That thin bone starts losing its texture and the gums become soggy. When the gums become soggy due to the lock of bone, teeth tend to distance each other and spaces start appearing. This is an irreversible condition in most of these times. So we have to diagnose it as early as possible to prevent further opening up of the spaces. But once the spaces have been opened, we have to prevent them from further opening also. You consult the doctor at the first sight of a space opening. We can treat it with a minimum composite filling, which will stop any further growth of a space or gap. If your gaps are too high, we can correct it through a removable or a fixed appliance also. When your gap is too high that it can't be corrected to any non-invasive measures, we can actually suggest you a smile designing therapy. In some cases, people tend to remove the posterior teeth or the back teeth and they don't mind to replace them. So there is a free space available for the teeth. All the front teeth start moving backwards and creating spaces in the front area. This is a very, very detrimental situation. So always remember, when you remove a posterior or a back teeth, it is 100% mandatory that you replace the tooth with a crown, or else all your front teeth starts shifting to the posteriors and it will start appearing gaps in the front area. When you see spaces, you just have to consult a doctor. They will diagnose whether it has been hereditary or genetic or functional or due to any disease, and the treatment modality depends on the cause of the problem. So when you see opening up of spaces, chiefly women and diabetic patients, definitely you shouldn't be neglecting that. Take a consultation, attend to the spaces, get them closed, get them covered, and prevent the spread of opening up of the spaces. That would be ideal for a good smile and a very good functional occlusion and teeth also.